I'm going to stay focused on the issue that I've been focused on for the past 10 years, which is we need an accurate source of providers in California, a provider registry that tells us where these providers are, who they're contracted with, and their availability. And from that, we can create the supply curve to match the demand curve, which is what we always talk about in health policy, is the demand side of it. I want to focus on the supply side. And in the pandemic, what became readily apparent very quickly was that we don't have good information on where providers are and who their connections are. And that manifested itself in a couple of dire circumstances. The beginning of the pandemic, we had a voluntary provider registry that readily identified about 4,600 specific providers who could respond to COVID immediately. These were infectious disease specialists and trained allied healthcare professionals. We could not share that information publicly because of a multitude of complex contractual relationships that governed how that information. We need that to be transparent and readily available. When the vaccine became available, the public health officers at the county level had no reliable source to determine which providers should get the vaccine quickly. So again, our lack of a provider registry, of an accurate database, failed us in a critical situation. So I hope that's a lesson that we learn from. I hope we get this nailed down quickly over the next year.